Hey mama, inductions are very common nowadays, although most women don't necessarily approach the end of their pregnancy expecting or wanting an induction. An induction becomes medically necessary though when your baby or even yourself is going to be healthier or safer with baby being outside the womb. When approaching an induction, it's important to know that there is often a process of several interventions that are used to ensure that baby is born sooner rather than later. And understanding what that process looks like, the various interventions that may be a part of that process, and the pros and cons of them helps you see the road that may be before you and how to make decisions along the way. In this video, we are taking a specific look at CERVIDIL and how it is used to kickstart labor. So mama, if you are being faced with an induction you weren't planning for, or if you're simply trying to gather as much information to empower you on this journey, this video is going to give you the information that you need to make educated decisions with your care provider for a positive and powerful birthing experience. I am Bridget and I'm a childbirth educator and birth doula, and it's my passion to help mamas know that they are built to birth. If you are new to this channel, don't forget to subscribe and hit the little bell so you don't miss any future videos. So what is CERVIDIL? The best way for me to explain CERVIDIL is that it's like a small flat tampon that is placed up by the cervix to help ripen it for labor. So you'll have this flat suppository that contains a type of man-made prostaglandin called dinoprostone, and it will be attached to a string that hangs down out of the vagina that allows it to be removed when needed. Prostaglandins are hormones secreted by the uterus, placenta, and even the amniotic sac, which surrounds your baby and is essential for the start and progression of labor. Now, CERVIDIL is often used when a cervix is not already soft, squishy, and beginning to thin or open, which needs to happen before labor can really begin. The purpose of dinoprostone and CERVIDIL is to ripen the cervix, make it really nice and soft to allow it to begin opening and thinning out, otherwise called dilating and effacing. CERVIDIL is not used to bring on contractions like Pitocin or even Cytotec does, which I either have already talked about in this induction playlist or will be talking about depending on when you're watching this video. CERVIDIL is typically the precursor to a Pitocin induction if a cervix is still hard and closed at the beginning. When the CERVIDIL is placed, it will usually take about 12 hours before it's taken out to check progress of the cervix. Typically, this will be something that will happen at night so that you can get it placed and then rest once you get it. You can move around and go pee after it has been placed, but usually your care team will want you laying in bed for about 2 hours after it's placed to make sure it stays put, and then your mobility is likely going to be regulated because the more movement and gravity that's being put on the suppository, the easier it can come out. So CERVIDIL is the only FDA-approved vaginal insert to induce labor, unlike Cytotec, which I've talked about in this video linked up here, that is not FDA approved and is a pill that can be used orally or vaginally. CERVIDIL may take longer than Cytotec, otherwise called misoprostol, to have a vaginal birth, but it actually may be safer for baby, as studies show that misoprostol used in Cytotec can lead to abnormal fetal heart rates. Now, so far in terms of dinoprostone, I've only talked about the tampon-like suppository that releases the prostaglandin dinoprostone. However, there is a gel that can also be used, but we're not talking about it really in this video because it's not commonly used due to its less effective nature. Compared to the vaginal insert, the dinoprostone gel increases the chances for a C-section as well as the need for more Pitocin later on to keep labor progressing. So because of this, most care providers do use CERVIDIL over the dinoprostone gel, but it is another method of using this kind of prostaglandin, which is why I wanted to mention it so quickly. So like I was saying, CERVIDIL is an FDA-approved labor induction suppository that sits in the cervix for about 12 hours to help soften and ripen the cervix for labor. CERVIDIL does not typically bring on contractions, although many women can feel crampiness in their lower belly while they are using it. The biggest risk posed to women using CERVIDIL is uterine overstimulation, where contractions are too frequent and a little bit too powerful and are putting a lot of stress on the uterus and cutting off blood flow and oxygen to baby, causing them to go into distress as well. So because of this risk, if CERVIDIL is used to begin the process of labor, mama and baby will be being monitored to make sure that mama's body is responding well to the dinoprostone and baby is responding well too and isn't showing signs of distress on the monitor. So the nice thing about CERVIDIL is that because it just sits by your cervix, it's easily removable, and your body can go back to functioning without it fairly quickly once it is removed. But before it's removed, if mama or baby is showing signs of not tolerating the drug well, your care team will likely start by helping you change positions or turn you on your side or increase fluids through an IV. But it's still nice to know that it is a process that can sort of be reversed in the sense that all that has to be done is to have it taken out in order for it to stop being effective, whereas other intravenous or oral medications would have to be flushed out of your system a bit more in order for them to stop working. Now, before we keep going, if you're liking this video a lot and you think other mamas in a similar situation would benefit from the information being shared in this video, make sure you give it a thumbs up so that YouTube knows to keep sharing it with more mamas like you. So there are a few things to think about when considering CERVIDIL. 1, it's generally a long process, typically overnight. 2, the fact that there are risks involved in using it. And 3, because of the risk, you'll need to be continuously monitored, which can impact your experience or make it challenging to help with labor progress. And 4, it is generally a stepping stone towards an induction using Pitocin. So as you're considering these 4 things, I encourage you to think about how you can help yourself stay calm and get the rest that you need throughout the 12 hours, give or take, that the CERVIDIL will be placed in the cervix. I encourage you to watch this video on how to create a calm atmosphere for your birth. 1, so that you can get the rest that you need before the intense work of labor begins, and 2, so that you can encourage labor to progress from the very beginning. Dimmed lights, eye masks, essential oils, a comfy pillow or a blanket, earplugs, these are all things that you can bring with you into your birth setting. In fact, I've linked several of those items below to help create a space that you can rest in. Consider to talk to your care provider about all the options that you have besides CERVIDIL and make sure that it's the best fit for your pregnancy. If you do move forward with CERVIDIL, how can you work around the monitors that you'll be continuously monitored by to balance out movement and rest, which can help engage baby and progress labor? Now, if it's the middle of the night, you'd be sleeping anyways, but if it's not overnight, how can you work around those monitors to help encourage labor to begin? And then lastly, talk to your care provider about what the course of action is if Pitocin needs to be used after CERVIDIL, or what happens if the CERVIDIL doesn't ripen the cervix enough. Remember, CERVIDIL is generally a stepping stone to another method of induction, which might be the Foley bulb or Pitocin, both of which we will be or have talked about in this induction playlist. So talk to your doctor about what kind of course of action they plan on taking, and when in doubt, ask questions. Use your brain to make the decisions you need to, like I talked about in this video linked at the top. Mama, I want to remind you that this is your birth experience and one that you will hold on to forever. So taking the time now watching this video to become educated and taking the time with your care team along the way to become informed on all your decisions is going to put you in the place of power and control of your birth experience, and will leave you feeling empowered by the choices you made along the way to bring your baby out of your womb and into your loving arms. I hope you are feeling equipped now for what to maybe expect if you are going to be using CERVIDIL, or about to talk to your care provider about on how to begin the induction process. Mama, you are built to birth. You are strong and capable, and thanks for being with me in this video, and I will see you in the next one. Bye, mamas.